In a recent public opinion survey conducted by our government, we just received the results yesterday, so this was done over the past week, and it indicates that 74% of Albertans feel that their mental health has been impacted by the pandemic, and 34% report that they are feeling, quotes, depressed or hopeless at least some days every week. Many people are feeling nervous, scared, or lonely, and almost half of those surveyed are worried about their future. Our message to Albertans today, especially to those feeling psychologically or emotionally overwhelmed, is that help is available. I am very pleased to announce today that the Government of Alberta is investing $53 million additional dollars into mental health support to help Albertans cope with the COVID-19 crisis. With this funding, we are launching a comprehensive mental health and addiction COVID-19 response plan. This is by far the largest investment in mental health support for people coping with the pandemic in Canada. In fact, the $53 million additional investment that we're announcing today is more than all of the other provinces' COVID-19 mental health responses combined times 2. So this is by orders of magnitude the largest investment in supporting mental health and responding to addictions at this very tough time. I'm told this investment is on top of the $140 million of additional spending that the government began to implement last year following the election in support for mental health services and addiction programs. It will hugely expand Albertans' access to online and virtual mental health and addiction services, supports, and resources, no matter where people live in Alberta. Our plan includes expanding the capacity of existing helplines, such as the Addiction and Mental Health Helplines, the Kids Help Phone, the Crisis Text Line for Alberta, and the Community and Social Services Helpline, which is 211. The funding will also expand online resources and platforms that provide advice and support and help to connect people directly to counseling. It will also strengthen access to the person-to-person online community where folks who are socially isolated can find sympathy and support amongst others who are dealing with similar issues. And they'll be able to access support 24 hours a day, 7 days a week from Alberta Health Services addiction and mental health clinicians when people need it. Later this spring, we'll also be launching a new online platform that will provide mental health screening, self-help guides, and direct support for counselors if needed. Direct support from counselors for people who need it. And we'll be launching a grant program providing up to $25 million to community groups that deliver mental health and addiction recovery services. Many of these groups specialize in helping people with unique needs in our society, including seniors, the homeless, families, Indigenous people, and others who may be suffering due to the pandemic and the economic crisis. Charitable, nonprofit, faith organizations, and small community groups are all eligible to apply for this funding to help us deliver mental health support on the ground to those who need it. Because some families isolated at home by the crisis are struggling with acute levels of domestic stress, the plan also provides additional funding to the Alberta Health Services Family Violence Services. This AHS service includes addiction and mental health treatment and support. It will be available province-wide, including for Albertans in rural, remote, and Indigenous communities, where social isolation may be even more challenging than it is in our cities. Finally, this mental health plan will increase addiction and services in primary care networks. This will include group, individual therapy, and virtual therapy provided by mental health and addictions professionals, as well as primary care physicians.
I want Albertans to know that we're here for you. All Albertans have experienced an enormous shift in their daily routines due to the public health order in place to keep us safe. In addition, the global pandemic impact on our economy has meant that many of you lost your jobs, taken pay cut, or have other financial concerns that kept you up at night. The stress, anxiety, fear, loneliness, and concern is something I can relate to. On the other hand, we've also seen our province once again come together in the way that we always do when we face with difficult times. We hear stories after stories about how Albertans across the province finding ways to taking care of their mental health needs, how they've reached out to each other to check in, how they've found ways to support mental wellness of their friends, family, and kids. Whether it's through video chat, phone calls, or online peer support, we see a lot of that. We also see many examples of small business stepping up to support Albertans across the whole province. In fact, it became quite evident to me that COVID-19 has brought a renewed focus on mental wellness for our province.